Good morning, everyone. In the first place, I want to thank the organization of this Congress, and especially for this program for the allied health professionals, for inviting me for this presentation and to share our experience that we have in the Netherlands. The content of this presentation will be a short introduction. Then I will tell something about the role of the nurse practitioner we implement in the Netherlands, and then the head topic, the clinical nursing research. The Netherlands is a very small country in Europe, marked here with a red spot in the big picture, and it has a length of 320 kilometers, and the width is only 180 kilometers. There are 17 million inhabitants, and the capital is Amsterdam. In the Netherlands, the people speak Dutch, and I would able to present in Korean if I didn't move Seoul when I was 4 years of age. I adopted to the Netherlands, and I grew up in a Dutch family, so my native language is Dutch. I work in the hospital, the University Hospital Erasmus Medical Center, and for the Netherlands it is the largest hospital with 1,300 beds and with over 11,000 employees. There are working 2,300 nurses, which 73 are working as a nurse practitioner. The role of the nurse practitioner is a high educated nurse with a Master of Advanced Nursing Practice. The nurse practitioner has the authority to indicate, diagnose and to treat on independent basis, and it's only in 2012 it is official legalized by law in the Netherlands. The nurse practitioner specialized and focalized for a specific group of patient populations. And my role is as a nurse practitioner, obstructive jaundice, that are patients with pancreatic and periampular tumors, cholangiocarcinoma, especially the Klatskin tumors, the hilar cholangiocarcinomas, the gallbladder carcinoma, and the common bile duct lesions or strictures. In general, my tasks are coordination of the clinical pathway, coordination of the clinical trials, and the total biliary drainage. Further, I'm responsible for the follow-up and for the nursing research. And I'm in a PhD path. My daily practice is divided in patient care, educate other professionals and research. And in patient care, that means that I follow the clinical progress on the ward. I have a telephone accessibility for patients and other professionals, and I see patients at the outpatient clinic and the emergency room. The education is especially for nurses, residents and other professionals, and in research I implement and have the continuity for the medical clinical trials, and I have my own nursing research. For this presentation, I choose two subjects to outline the nursing research. And the first one is the medical information for patients with pancreatic cancer and the percutaneous transhepatic biliary drainage. For the medical information for patients with pancreatic cancer, we divided in two types of research, interviewing people, and we did a focus group. For the PTBD, we evaluate the placement of the procedure, and we did a survey amongst nurses about their knowledge and care of percutaneous drains. For the need for medical information, the background is that, as we all know, that pancreatic cancer has a high morbidity and a high mortality, and there are a lot of physical problems with those patients. The aim of the study was to assess what questions pancreatic cancer patients have and where to find the answers. The first part, interviewing the patients, we finished, and the questionnaires who can patients fill in online is almost finished. So I can tell something about the results of the interviews, and there were two remarkable outcomes. The first one was that the amount of questions patients have in the first weeks after diagnosis differs substantially. That means that the amount of questions differs between 3 questions till 44. And the other outcome was there was no regulation perceived as if it no longer matters. And that was a new point of view, because I never thought about it, that patients could interpret it that they have no diet restrictions, for example, that it was interpreted like in this way. From the focus group, we did an evaluation of the clinical pathway of the obstructive jaundice. We started in 2008. And the aim of the study was the experience of the clinical pathway from patients' perspectives. And what they tell, what the main experience was, that they don't have any, didn't find any positive experience on the internet. So people were looking for information on the internet, but they stopped because all the experience they're shared on the World Wide Web were very negative. And that came to some recommendations from these studies, and that is that we inform about the diagnosis and treatment for patients with pancreatic cancer, demand-driven. So when I see a patient and I have to inform the patient, I always tell him that they can ask me everything and I will give an honest answer, but the amount is differs so many, so it has to be demand-driven. We want to implement informational interviews at hospital discharge. So we hope that we can inform the patient that they are more prepared when they are make the change to leave the hospital. And we want to make a list of reliable internet sites to inform the patient. The second study I want to share the outcome is about the evaluation of the percutaneous transhepatic biliary drainage procedure. And the background of this study was that patients returned from PTBD procedure with pain despite analgesics that were administered during intervention. So the aim of the study was to study the painfulness of the PTBD procedure. The evaluation of pain, we used numeric rating scales for evaluate the pain, and we registered baseline data like time duration of the intervention, dilation of the biliary system, and the pain medication. And what we find out is that the amount of the numeric rating scale was high, but there was not really a difference between dilated bile duct system or a non-dilated bile duct system. So we thought before that maybe a non-dilated bile duct system, that it causes more pain. The other study was amongst HPB nurses in the Netherlands, and to study what their knowledge is about PTBD catheter care, because I got a lot of questions about this care by patient and nurses. So the aim of the study we formulated to study the level of knowledge and catheter care of PTBD amongst HPB nurses in the Netherlands. First, we did a search in PubMed, and afterwards we did also a literature search in CNAL and Cochrane, but there are not a lot of publication about the catheter care for PTBD. So we developed a questionnaire, and it was reviewed by HPB surgeons and gastroenterologists and HPB nurses. And we distributed the questionnaires among participants at 2 nursing HPB oncology congresses. But we didn't have enough response, so we sent all the hospitals in the Netherlands an email after a telephone contact and asked them to fill in the questionnaire. And I will show some of the results of the questionnaires. And that is that the nurses are thinking that their knowledge about catheter care is not enough. Their own knowledge is only 45%, and even the knowledge of their colleague is even 30%. And about knowledge about the procedure, only 60% will ask us for coagulation before the intervention and gives antibiotics prophylaxis, only 45%, and only 37% gives the pain medication before treatment. And that is remarkable because the nurses gave a number for the pain for the intervention, and it is between 6 and 8. And the question was, is there a protocol on your ward? And remarkable is that only 40% works with a protocol because the others don't have a protocol or don't know that there is a protocol. Summarizing, that is that adjustment of the pain medication protocol during intervention was necessary. So we adapted the protocol, and we start lately with a protocol with remifentanil. It's an opioid and has to be administered with anesthesia. So I organized a training for the professionals at the interventional radiology department, and we started with a training to start with this medication protocol. And further, I think there's need for an education program for specialized nurses all over in the Netherlands. And since 10 years ago, there starts a process of centralization of the operations in the Netherlands, so that low volume hospitals are not allowed to do some of the operation, and maybe centralization of procedures like this is necessary in the future. Okay, I thank you for your attention.